Welcome to WWDMD, a podcast that is all about peeling back the curtain on what clinicians really think and feel as they work with others. My guests, clinicians, who are also sometimes clients themselves, risk their vulnerability as they publicly share their emotional reactions to their clients, disclose their challenges in doing the work, and reveal their personal backgrounds. I'm Dr. Meyers. I'm a psychotherapist in New York City with 30 years of practice experience, specializing in anxiety and depressive disorders, as well as sibling relationships and family systems. I'm also a professor of social work at Malloy University on Long Island. I see this as a journey of self-reflection for not only our guests, but you, because with each episode, I'm hopeful that you will learn something new about yourself. Please note that any discussion of case details have been modified to protect the privacy of our clients.
What would Dr. Meyers do?
Hey everyone, I wanted to share my perspective on psychiatric medication. It's not really so clear-cut, and I wonder if I have a pro or con perspective at the end of this. But I wanted to share nonetheless the thoughts that I've had over the years and where I've come to on this. There are those who believe medication is the cure to mental health and those who are deeply opposed. It raises the question, who should take medication? And I believe that it's a deeply personal decision. Everyone and anyone has the right to self-determine if medication is for them. Now, loved ones may hope that medication will change their partner or their child or their friend or whomever. They may even see or may have seen the benefits of medication for their loved one from a previous experience and know that it can help. However, medications have side effects that aren't always pleasant, whether it's depression as the side effect, even suicidal ideation, or dry mouth, or sexual dysfunction, etc. You know the commercials you see for ads that promote the medication for 30 seconds, and then the next 2 minutes are a list of potential side effects that are rambled so fast it's hard to take in. That says something. Medication is not a cure-all, and it's not a one-size-fits-all industry. This means that even though there are specific and multiple medications aimed to treat, for example, depression, and how ironic that a medication to treat depression can cause suicidal ideation, my point is that what works for one person with depression may not work for another person with depression. And therefore, someone may have to go through several trials to identify the one that works best. This, coupled with potential side effects, can make this route extremely overwhelming, frustrating, depressing, unpleasant. The side effects may be so uncomfortable that someone chooses to live with their mental health symptoms. It reminds me of the mantra, my body, my choice. As long as someone is not suicidal or homicidal, I believe the decision should be theirs. But it's complicated. It is. As a helping professional, my perspective has shifted over the years. Once upon a time, I was not one to recommend medications to clients unless they were part of the SPIMI population. This stands for seriously, persistently, mentally ill. It's those with schizophrenia, bipolar disorder, chronic post-traumatic stress disorder, anxiety, just to name a few. So serious, persistent mental illness is a term used to describe a range of mental health conditions that are chronic and cause significant functional impairment that impact a person's ability to carry out daily activities, to maintain relationships, and to function effectively. I mean, hearing voices and being manic are not something one can work on in therapy. I got that. But here's my shift. There are many other disorders, such as attention deficit disorder and depression and anxiety, that can make functioning extremely difficult. So why not alleviate the pain? If you have a headache, you take an aspirin. But consider medication as a short-term intervention. Again, not for serious, persistent mental illness. I know many people who have been on the same medication for years, and I mean years, because either they are conditioned to its utility from their doctors, or they fear what will happen if they go off. And these are high functioning folks. And maybe there is risk to not be on the medication, but one can try it and then always go back on the medication if they find themselves feeling impaired. Now, even though there is risk to being on medication for a lifetime, there's also risk for some in being off of it. Now, I know we are a society that emphasizes medication, if not pushes it. 1 in 5 Americans is taking psychiatric medication, including millions of children. There was a movie, I think it was produced in 2020, called Medicating Normal, and it explored the potential adverse effects of psychiatric drugs and questioned whether they are being overprescribed in the United States. It shows stories of people whose lives were negatively impacted by these medications, and also explored the role of the pharmaceutical industry in promoting their use. Pharmaceutical companies have overhyped the benefits of these drugs while also hiding the risks and severe side effects, including physiological dependence. So when for-profit medicine intersects with humans in distress, we have to be thoughtful about how medications are being prescribed and mindful of the benefits to the doctors who do the prescribing. So, for example, psychiatrists may receive research funding or payments for speaking engagements from pharmaceutical companies. This can influence their prescribing decisions and lead to a greater likelihood of prescribing a company's favored drug, right? Rather than the one that best meets the needs of the patient that they're seeing. There's an emphasis on medication over other treatments, which can contribute to over-medicalization and a reduced emphasis on psychotherapy or other non-pharmacological interventions that might be beneficial for certain patients. Doctors have limited training in psychological therapies. Some healthcare providers, particularly those in primary care, may be less equipped to identify and address psychological problems, making medication a more appealing option due to time constraints and of lack of training in other therapies. And we like quick fixes. Then again, some people who need medication may refuse it due to societal attitudes and media portrayals that contribute to a negative view of psychiatric medication. With that, patients may internalize stigma surrounding taking psychiatric medication and feel shameful for taking them. I believe psychiatric medications can be vital in treating mental health conditions and improving lives, but we need to balance the use of medication with other evidence-based treatments and demand transparency in the relationship between psychiatrists and the pharmaceutical industry. I believe in a holistic approach, one that considers the patient's individual needs, including access to therapy and social support. I've come to believe that if functioning is impaired and medication can help to reduce symptoms and activate functioning, it can be very useful in conjunction with therapy. Otherwise, the medication is a Band-Aid that can become the cure-all for a lifetime. It can be healthier medically and mentally to learn coping mechanisms and techniques to address the symptoms of disorders. Now, if we look at those disorders that are physiological, right, that means due to brain chemistry, then this is another reason why medication may be helpful. But it doesn't mean that those feelings can't be also addressed in other ways. Let's focus on anxiety and depression as examples. These are two mental health diagnoses that can be biochemically based or situationally ignited. Either way, medication can be useful. In the case of situational anxiety or depression, perhaps there should be a period of time before medication is considered the key determinant. But also, the intensity of anxiety or depression should be considered, even if it's a short duration, 3 months, 6 months, but it's hindering functioning. For example, having a hard time getting out of bed, being unable to control crying at work, or having panic attacks, or having paralyzing anxiety. Medication may take off the edge enough to be able to address coping skills in therapy. When someone is so consumed by difficult emotions, another example could be obsessional thoughts, sometimes the therapy doesn't help if the work can't be done. Another, argument for the utility of medication. Now, concrete skills or shifting thought patterns and behavioral interventions can be a powerful tool as an alternative to medication. I work from a psychodynamic lens. This means that I tend to focus on how we developed, our parenting, our environment, our experiences, and how that has shaped who we are, how we think the way we do, and how we behave and relate the way we do. I also believe that clients should be given feedback and that they learn and can change how they relate in the world by becoming aware of how they are relating to the therapist. We can learn a lot about someone from the client-therapist relationship. Psychodynamic therapists also do a lot of reparenting, helping to build somebody's ego and belief in themselves. And with the understanding of where the client's emotions and perceptions come from, we can work on healing those emotions and shifting those perspectives. That being said, working on shifting irrational thought processes and working with concrete interventions is important. This is more of behavioral therapy or cognitive therapy, that sometimes we develop thoughts that don't have any evidence in their value. In other words, if you always think that you're going to be failing at something and you never really have failed, but you're still fraught with that anxiety each and every time you face a new endeavor, we have to shift these irrational thoughts. And if medication is needed as a supplemental tool, it's something to be discussed, with always in mind the client is the captain of the ship. So what's my conclusion on medication? Do your own research, learn about side effects and the risk-reward ratio. Understand the evidence-based practices for your diagnosis. Consult with your therapist. If you don't have one, find one. Remember that a medical doctor will prescribe medication, but they are not trained in emotions. So consider who will be monitoring your medication. Question your prescribing doctor to inquire about the relationship with the pharmaceutical company. Yes, you're allowed to ask. You're allowed to inquire about things that impact the decisions that are being made to treat you. You may also want to consider alternate ways of working on your issue and determine what you are most at ease with. Again, remember that this is your decision to make. I wish you well, I wish you informed decisions, and I wish you satisfaction and beyond. Thanks for listening. I really do appreciate it. If you like what you heard, please consider leaving a rating and review on your podcast platform, and don't forget to subscribe so you don't miss my next episode. If you're struggling with clients, I'm happy to consult or provide supervision. Consultations are also available for any person listening. If you're struggling with sibling abuse, you may want to join my sibling abuse workshops. I'm open to feedback on topics you'd like to hear or questions, so feel free to email me at drmeyerspod@gmail.com. You may be interested as well in checking out my blogs on my website at amymyersphd.org.
I've got some problems, yeah, I've got some questions. I need some help, point me in any direction. Clinical guidance is what I need to help me become who I'm meant to be. I've been searching for a teacher, another point of view. And I've been asking myself, what would Dr. Meyers do?